let's read about the public health services in India. But before that, let's be clear about what a public health service means. It is in fact a chain of government hospitals, dispensaries and primary health care centers where the common illness or even special services can be provided to the ailing citizens. So, it is just the government hospitals, dispensaries, primary health care centers where the people can go when either they are just sick or when they are in deep trouble. Okay? There are a lot of primary health centers in India where the people keep going for common and major ailments. Now, why is the service called as public health service? That is, why is the word public being used? Now, there are many reasons why we call it public health, because all these services, that is the hospitals, dispensaries and the primary health centers, all of them are there for all of us. That is, there is no distinction of rich and poor, of urban or rural, male or female. Everybody can go, and since it is for all of us, for all the people, that is why it is called as the public service. The second thing is that the money which is required to build and run these services is being taken from the taxes the public pays. That is why it is again called as the public system. Well, the third factor is that these services are meant to provide quality service to the poor who cannot afford to go to private hospitals. That is why it is meant for poor public, for the public. That is why public services. Next is that there are certain diseases like tuberculosis, malaria, jaundice, cholera, dysentery and so on, which the government cannot eradicate without the participation of the people. That is, even the efforts of the people are required to eradicate them. That is why it is called as public service. For example, for the eradication of malaria, just the dose of medicine is not going to work. You have to keep your house clean and disinfected. That is why. Then, what does the Constitution of India say about the public health services? It clearly states that it is the primary duty of the government to provide these public health services, since it is right to life in the Article 21 of the Constitution, and under the right of life, health is a very important factor that we have. Even the emergency services that are to be provided should be given, they say, even by the public and the private hospitals. That is, in emergency situations like accidents or some other unseen calamity, the people have to be admitted even by the private hospitals. They cannot deny, as we have seen in the case of Hakim Shah, when the government or the court gave the order that since he had to spend lot of money and he had fallen from the rail, therefore he was given compensation in the manner that whatever he had spent was given back to him. So, this is all about the public health services in India.